Perspectives on Trauma, sharing our views and healing our world.
Hello and welcome to Perspectives on Trauma. With me today is Leigh Figueroa and Ilana Gerjuoy. Welcome.
Thank you. Thanks for having us.
The first question I guess I would have is, could you talk about some of the things that are going on in this region to address collective trauma?
Sure, absolutely. Well, we both work at the Franklin Regional Council of Governments and the Communities That Care Coalition. So our focus is really on youth, mental health, and well-being in the whole region of Franklin County and the North Quabbin. So some of the things that we're looking at, this data has been collected for, I think, 22 years now, is just assessing all of the young people in the region every single year, thinking about family health and well-being, attachment to school, and the histories that young people come with, all with a view to prevent substance use, as well as think about like how to maximize the well-being, because when you're working with young people, you're working with a whole family system, you're working with a community. If that makes sense.
Of course.
Yeah.
So what we do is we take this data that we have from these student surveys that are done every year, and we can look and see what's happening for youth right now. You know, have they been concerned more about larger issues like climate change and racial justice in the communities? Have they been using certain substances more? Have they been feeling more lonely and isolated due to COVID or other things? Have they been reaching out? You know, so we can find some different things about what's going on with them. And then from there, we look at things in terms of risk and protective factors. So risk factors are things that make something that's not as healthy more likely. So it could be a disease more likely, or it could be, you know, a behavior more likely. And then protective factors are the opposite. They're those things that actually help to make positive things more likely. And so some things that we work on are trying to reduce the risk factors and increase the protective factors. And that can be anywhere from supporting young people's individual skills and knowledge to their community, sort of what is their neighborhood and community like that they're growing up in? What is their family system like? Does their family, do their parents or caregivers have what they need to take care of the young people in the house and to reduce their own stress levels and keep their kids safer? And then what do schools have? Do they have what they need to support young people as well? So those are some of the main things that we think about in sort of a larger sense.
So it sounds like a multi-team approach.
Mm-hmm.
Okay.
It's there's an illustration that is used a lot in the field of prevention where there's a village and there's every day people in the village go down and there's someone drowning in the river. And they're like, oh my gosh, we got to pull this other person out of the river. And every day they're pulling people out of the river. And so that's the response, right? So when there's trauma, when there's things happening, there's all this, like we need the mental health supports. We need, you know, the recovery spaces. We need places to help people who are in the crisis. But what prevention does is it goes upstream. It finds out why are people falling in the river in the first place. And so that's what a lot of our work is to try to prevent the conditions that lead to trauma, especially in young people and children, before they ever experience it.
Mm-hmm. So I guess working with the data that you have, can you talk about, I guess, how has it progressed? You know, is it always, it doesn't seem like it's always been where it was data driven. So could you talk about some of that?
Sure. I mean, I think that, 22 years ago when this started, where I was not a part of the work at that time, a lot of it was driven because there was a tremendous amount of substance use amongst youth in the region, right? There's the opioid epidemic was beginning, like all of this stuff was happening. And so it was really focused on the substance use prevention. And at the time, the data reflected that. A lot of substance use in the region. And over the years, with all the different interventions that we work on, so evidence-based programs, putting them in place, in all the 9 school districts in Franklin County in the North Quabbin region, having those programs happen for all these young people created this dynamic effect right across the region where all of these youth were getting this information, and that helped to bring down the rates of substance use. And in turn also bringing in or supporting social emotional programs, mental health programs, a number of things. And then one of our most recent projects, or grant, our work is grant funded, is looking at racial justice and equity in schools and understanding that, you know, racism is a public health crisis and it's a driver for a lot of risk factors for young people and their families and their communities, as well as we see a lot of elevated data in our region for LGBTQ youth as well. So the numbers change over time. Overall, 22 years, there's been this decline in substance use, which, with the exception of the spike of cannabis when that was legalized, of course. But the other things we see rising are significant mental health concerns, lowered attachment to schools, lowered attachment to a person at school that young people can go and connect with when they need support. And so we look at all these different numbers and say, well, what can we, you know, what are we doing that's addressing this? What else can we do? What partners can we bring in? You know, who's working on this over in this organization? And are people thinking about the correlation between social media, screen use, and teen girls' mental health? You know, who's working on that? Let's bring this all together. So that's one of the ways, I'd say the primary way that we use data in, you know, in our work.
I guess looking at the effects of communicating this information to the people that you're working with, can you talk about, you know, some strategies that you use to help people understand, okay, we're doing things a certain way because these are kind of where the numbers are telling us where to go? Absolutely.
So we have a few different ways that we like to communicate this. And one of the ways that we actually communicate our data is about communicating the positive. That's a big focus of our work. One thing that we do is we work really closely with local public schools, and they are really interested in seeing the data from their own school district and knowing what they can do. They're really committed. I mean, the schools around here, they care so much. And even though we might be seeing in the data that, you know, as Leigh was saying, some students are feeling less attached to a person at school, a lot of that is because the school staff are stretched so thin. So they're really, I guess I would say, a lot more trauma informed than they were 20 years ago. So much more. It's kind of amazing, actually, how much more trauma informed schools are. But back to the data and how we communicate it. We like to talk about some of the good things that are happening. So we'll talk about how there have been, there's been a decline in substance use. Or did you know that, you know, 95% of students in the region would try to get support for a friend who was thinking about suicide? Did you know that about 60% of students in the region are involved in at least one extracurricular activity? So some of those positive protective factors. And then also, did you know that, you know, 80-something% of students at your school don't vape or don't drink or don't use cannabis? Now, I'm not using the exact numbers from the survey because I don't have them all in my head, but they're around those. It's actually pretty high numbers of students who are not using a lot of substances. And so that's one way that we communicate that. It's called a positive social norms approach, and it really helps to show the positive things that are happening in the community. It can help to show the great things that the schools are doing, and it also does actually have positive behavior change. So when young people see that the norm is to actually engage in healthy behaviors and to not engage in less healthy behaviors, they're more likely to want to be part of that larger group. So that's one major way that we communicate. And in terms of sort of the mechanism for that, we have, you know, the regular stuff, press releases. We go back to the schools and we have meetings at the beginning of the school year or just before with every school and say, here's your data. And then we try to also bring it back to the students themselves in a variety of educational forms too. If I'm missing anything, feel free to
No, I
add
think you
into
got
that.
it.
Well, I guess thinking of, you know, the preventative approach, in looking at taking something, I guess where I'm going with this is if we have some data that was, technically old data, but we're still moving forward with the new issues. How do you balance the prevention of the assessed social issues with obviously understanding that they're maybe new developing?
Yeah. I mean, I think, early on the coalition decided to focus on 3 risk factors, and I'm not going to remember all of them, I think, but I know it was family attitudes, parental attitudes favorable to substance use, community norms and policies favorable to substance use. So can you go to the store and buy alcohol without getting carded? I'm not going to remember the third one. Do you remember?
Family management.
Family management. So is this family system, how does the family system work? Do the parents, or caregivers know where their children are? Do they have the tools and strategies to support their children in healthy ways, and know how to communicate with their children? So we've continued to hold those for the past 22 years, but also adding and recently looking at mental health as a major factor in what we're seeing in the region, and really a major factor in what's driving current substance use. So it used to be 22 years ago, I hear that young people use substances because it was like this peer pressure. This is cool, let's try it, everybody's doing it. And now what we see more is youth using substances to cope, right? So they've had a series of traumatic events potentially already in their life. They're struggling to make connections. They're more isolated than certainly since the pandemic, but even before then, we started to see trends in isolation as more and more young people became attached to smartphones and social media. And so we sort of integrate these pieces into what we're already doing, because really it's a dynamic system. All of these things work together in terms of what contributes to a healthy community. And really that's the goal, is to improve youth health and well-being across the region, which, as I said earlier, just really comes down to what makes a community healthy, and how can we just look at a few pieces of this and work with the families locally and work with the systems we have locally to say, if we all work on this thing together, we can transform what's happening in our community. And I'll add to that, this model, Communities That Care Coalition, is a national model. There's Communities That Care coalitions all over the United States and maybe other places too, but I know in the United States, and so there's a lot of other people who are doing this work across the nation, using similar strategies, looking at a region as a whole, and trying to bring together the folks that it impacts the most. We want the families at the forefront. We want the youth at the forefront. We don't want to be sitting in a room being like, we should use this strategy, or let's put this program in. It's so important that this work is done in collaboration and in community. And I would say that's a real strength of our coalition and in this region, is that these organizations, the district attorney's office, the schools, the social service organizations, the community centers, have this long-standing partnership where everyone is in communication and working together. And that's what's really shifted, I think, a lot of the negative outcomes that were happening before, and helps address some of the struggles we're seeing now. So I don't know if I think I took your question and ran with it a little bit, but I would say that's how we sort of hold where we were and bring in what we're seeing that's emerging.
Well, I guess looking at it sounds as if it's, the fundamentals are the same, way the details change. Thinking of, what has been the experience of working with community partners, and I guess informing them of their impact and getting them to have more buy-in to engaging in the process?
Oh, that's a great question. Well, and I think a lot of it is, we'll share our data with community partners, but they also have so much qualitative data, that non-numbers, non-survey type data. Because if community action is seeing thousands of people come through their doors in a year, and they're hearing a lot of the same things at the family center or at their youth and workforce development programs, if the schools are seeing, in their guidance office or their adjustment counselor's office, students coming in and saying the same things, they have so much important information. So it's really a two-way street. So what we do is we'll say, this is the data that we have. We're seeing that, you know, students have these concerns. Youth are experiencing this, or this is how the behavior is changing, for better or for worse in some way. So what can we do about that? And how does that reflect your experience? Then we'll have all these other agencies at the table saying, oh, we're seeing that too, you know? And so because of that, we want to make sure that, you know, for example, youth and workforce development programs at Community Action now has a drop-in space for youth, and it is specifically meant to be a very welcoming space for LGBTQ plus youth, but it's open to everyone of all genders and all sexual identities. And so that's like a place where young people could go after school if they wanted a place to go and get a whole bunch of support. I think the other way that I think that things get more integrated with those community partnerships is that, you know, we work in prevention, and so we see that kind of upstream view that Leigh was talking about, but we work closely with people who do intervention and do treatment and do recovery related to substance use and all sorts of other issues in the community. And I think that's something that really drew me to this coalition work, because I used to do direct service work, and I saw all the things that people were needing right now that were, you know, in a crisis situation. And I thought, that needs to continue and get better, but what can we do to prevent that from happening in the first place? How could we make the housing system better so that people don't end up on the street in the first place? How can we make sure that schools are more aware of childhood trauma so that if a child comes to them, they get intervention right away? And I think that all of that collaboration that Leigh first brought up just really helps with that. So for example, we're on the Franklin County Resource Network listserv, which is just like a local listserv of I don't know how many people. It's through Community Action, but it's a really big listserv, and people will literally come on there and be like, hey, we're hiring for this position. And then someone else might come in and say, I'm working with a client, and they're a low-income family moving into a new apartment that they just got. Yay, but they don't have any appliances, and this apartment doesn't have any. Anyone know where they could get a refrigerator? And someone, usually within 24 hours, says, oh yeah, we have a program, we can help them get a refrigerator. Oh, have you talked to so-and-so at the Raft office? Oh, did you do this? And there's like this really great synergy, I think, between prevention and intervention now that I didn't see when I was earlier in my career. So it's pretty exciting. And I work on policy now as well, which is like another piece of prevention, which I'm not going to get into, but that's also exciting to see how on all these different levels in our region and even across the state and across the country, there's more awareness of how all of this is so interconnected.
It sounds as if it's a what people may refer to as a holistic approach. Okay. I guess not going into specifics, but what types of organizations have you identified that, okay, if only they were at the table too, this process would be even more complete? Have you identified any of those? Or?
Yeah, I mean, I think when we're starting a project, one of the first steps is always who needs to be at the table, you know? So one grant project that we work on, which is focused on, the title of it is State Opioid Response Prevention in Early Childhood. The first step with that, so we're looking at how do we help young children never get to a substance use disorder, and how do we help families that are maybe coming out of that in recovery or seeking to enter recovery as they have these young children, which is a time of life which can be really stressful for everybody across the board. You know, having a baby, a newborn, and then a toddler is a very stressful time for families. Happy, but lots of challenges. And so the first thing, one of the first things that happened after the funds, like after we said, okay, we have this grant, how are we going to move forward, is we met with a group called the Early Childhood Mental Health Roundtable. So this is a a group of hundreds of providers doing all kinds of work connected to early childhood across the region. So you have folks who work with DCF, preschools, early intervention, family resource centers, all of these organizations and partners that intersect with young children and their families. And one of the first things we said is, okay, who isn't here? Who else do you all know of that we need to be in contact with as we think about, okay, we got this pot of money, what does the region think is the best intervention to support families and children from later in life substance use? And that kind of collaboration really helps sort of pinpoint what the region's already investing in, you know, where people are already putting the work, the folks who are on the ground doing that direct intervention work, you know, working directly in service with families. And then that gives us the information about, like, so where can we support the good work that's already happening? And in this case, the community was like, we need this program, we're already doing it. It reduces bias in providers and reduces stigma, positions the parents, the caregivers as experts on their own children. And so one of the things, of course, that often families can feel is judgment. When, you know, folks are in recovery, when they're struggling, when they aren't coming in, when they're coming in feeling like someone might be looking down upon them in some way, they're less likely to want to work with those people. You know, no one wants to feel judged or stigmatized. So the intervention that the community said is, we're already doing this program, it's a training for providers, it reduces bias, it reduces stigma, it helps support the families, we need more of it. Can you help us get more of it? So that's what we did. So, you know, it's really, we rely on the community to tell us, you know, what else is needed. It's not, this isn't a thing that can ever be done in silos. And I'll say one more thing about this, which is that the Communities That Care Coalition, before I came on board 2 years ago, but there was a lot of work in sort of looking at the function of the coalition and identifying sort of this grass tops approach as opposed to grassroots, and saying, okay, we've been doing all this amazing work and we've got all these community partnerships, but you know, we've really been sort of leveraging with people who are like the head of this organization and the folks who are, you know, the people who already have a seat at the table. How will we increase the voices of the people that we're looking to support the most? You know, how do we begin to, I think it's the disability justice movement that says nothing about us without us, you know? And so that's really been the push of the coalition, to include more family voices and more youth voices at the center, to say, like, you know, it's not for anybody to make decisions about anyone's life without the people whose lives we're talking about making those decisions in partnership.
I guess, coming as a provider, could you talk about some of the similarities and differences of working with someone directly to overcome shame and guilt in some of these issues versus working collectively at a systems level?
Oh, that's a great question. So I was thinking more about all the other people we work to include, and then that's a great question that I'll have to move my mind to. So I think, well, you know, there are certainly differences, but actually what comes up first is some of the similarities, which is, like Leigh said, you know, that nothing about us without us philosophy is so important. And so I feel like when I used to work directly with people who'd experienced a variety of different kinds of abuse and trauma, one of the most important things to me was that we used a real peer model a lot of times. Even if there were people in the agencies I worked with who had, you know, credentials and were licensed, you know, we really used that peer model, which said, you are the expert of your own life and your own experiences. And so I might have some training, I might have some information, but really you're going to know so much more about you than I can ever know. And I think having experienced some, you know, traumatic experiences myself in my life, I just felt like, you know, we're here together working on this. The two of us are sitting here together working on this issue, and I have some distance from it because it's not my life this time, and you have the expertise because it is your life this time, and let's bring that together. And when I would work with those people, sometimes the biggest challenges in their lives would be the systems that they were working with. So it was really hard to find housing. It was really hard to be heard at their job about what they needed to stay safe. It was really hard to not be stigmatized in some other place. And so getting to work collectively is really wonderful, because then we get to talk with all those people who are engaged in those systems and talk about systems change with the people who work in the systems that also want to see change to make things more accessible for everyone and more welcoming for everyone and more inclusive. But I actually think that, in a way, the commonalities are more similar than the differences, or there's more commonalities than differences, because in all of it, it's about that feeling of us and we that works really well, I guess in my opinion at least, and I think in Communities That Care's opinion as well, instead of like, we're going to come in and help you. You know, it's this collaborative approach, which for me, when I think about trauma, feels just crucial. I guess because trauma is about having choice and taken away and feeling helpless a lot of times. And so how can we bring that, you know, really support what feels empowering to people without saying, I'm giving that to you.
Yeah. Can I add
Of course.
something to that as well? I was just thinking about too how in our work we really focus a lot on living experience and not lived experience. You know, so recognizing that this, you know, being a human is messy and life is messy, you know, and so can sometimes in the field be this sanitizing of, you know, like what it's supposed to look like and how do we intersect with people, and the road to recovery and trauma treatment. It can feel sometimes the messiness of the realness of it, I think at the decision-making table can sometimes feel like a thing that folks can have a hard time grappling with, if you understand what I'm saying. It's like, it's this really tricky thing of like, how do we say, you know, like this person is having an active substance use disorder. That doesn't mean that their voice is not valuable. That doesn't mean that they don't get to also be a part of what we're doing, right? Recognizing that, like, you know, we need to be able to just kind of hold people where they're at, and that the system needs to have spaciousness for that. You know, the folks who are working on interventions need to have spaciousness, because sometimes we want to see like sort of this cleaned up version of like what we think it's supposed to look like, or, you know, what mental health looks like, or recovery, but it's all cyclical, right? It all, like, it comes around and around. It takes time. So I think, you know, in our work, we have a program called the Peer Ambassadors, which is folks from the community who have a number of different lived and living experience identities, and their parents, caregivers, who are trained to go out into the community and give resources to other parents. And I think in the 3 years that the program's been going, they've reached almost 3,000 parents, have spent over 3,000, I think it's like 3,200 hours in community service, just saying, you know, do you need diapers? Here's where you get them. Do you need legal aid? Let me show you, let me connect you with the person. Your child has a disability and needs an IEP. Here's how you get an advocate. You know, these caregivers who are going out into the community because it's their community, right? So they're saying, like, it's the people with the people, you know, connecting, not someone coming in to say, you know, oh, here's the intervention. I have prepared it for you. And, you know, now I will go on my way and write my report, right? We really want our work to not be extractive, right? But to say, you know, we recognize that this is difficult. We recognize people's lives are complicated, and we're here for it, you know? We want to, like, hold that and respect it, honor it.
Well, I'd like to thank each of you for taking the time to speak with me today, and I wish you both the very best.